Hi, I'm Dr. Brittany Todd with Sacred Heart Clinical Pharmacy Specialties, and I want to talk about the side effects when it comes to birth control. Birth control, most people say, oh, not a lot of side effects. It might make you gain weight, it might make you lose weight, it might make you a little bit nauseated. But overall, it's a beneficial drug because now you're not getting pregnant, right? Well, that's wrong. This is one of those medications that society has accepted the risks despite them being incredibly high. Almost every woman who has been on birth control can tell you that they have some sort of side effects. They have acne, they have breast tenderness, they have shortness of breath, they have headaches, nausea. Those are more of the common side effects, but the less common but still somewhat frequent side effects are super, super concerning. Estrogen, especially in birth control, can cause blood clots. This is why people with migraines, especially migraines with aura, when they start seeing vision changes and have severe headaches, women with migraines, especially with aura, should not be on estrogen-containing hormonal contraceptives because estrogen increases your risk of blood clots. And it complicates the picture because a migraine with an aura sometimes presents kind of like a stroke. You're having vision changes, blurry vision, severe headache. That sounds like a stroke, and we cannot tell the difference between a stroke and a migraine with an aura because now you're on an estrogen pill that increases your risk of blood clots. And a blood clot in your brain is a stroke. You see the dilemma there? If we give you something that causes a stroke and you happen to have a migraine with an aura, we don't know, is it just a migraine with an aura or did we cause a stroke? So that's one huge issue with birth control. They cause blood clots, not just in your brain. It can happen in your heart. It can happen in your leg and cause a deep vein thrombosis, a DVT. It can happen in your lungs and cause a PE, which is a pulmonary embolism, and a blood clot in your lungs, and that could break off, go to your brain, and cause a stroke. Strokes, lung clots, and heart attacks, clots in your heart can cause heart attacks, can kill you. These are not incredibly rare. In fact, I think Justin Bieber's wife had a blood clot in her lungs. I'm pretty sure. This is not that rare. I know several people who were told you cannot take hormonal contraceptives. You know who else is at risk of blood clots are women who smoke while on hormonal contraceptives. So blood clots are a severe, scary issue. Shortness of breath is a sign of a blood clot in your lungs. Chest pain is a sign in your heart. Headache is a sign in your brain or in your head. And red, puffy, inflamed, painful spot on your legs. Those are signs of blood clots in your legs. All scary things. So that's one major scary thing with birth control. The other thing is cancer. It is actually classified. Hormonal contraceptives are actually classified as carcinogens, cancer-causing drugs. Let me say it again. Hormonal contraceptives are also classified as carcinogens or cancer-causing drugs. We know they increase your risk of cancer because it's estrogen and progesterone at higher doses than your body normally produces. Yet we're sitting here saying, go ahead and take birth control. You know what? Let's start it when you're 10 and let's keep you on it until you're 45 and start menopause. And the only time you're off of it is, the 1 or 2 years here and there that you want to have a baby. But we're okay with giving hormones at abnormal doses to regulate your cycles the way we want to regulate them for 30 plus years. There was a study done probably in the early 2000s that looked at hormones in older women using it for hormonal replacement therapy. And they found that they were at an increased risk of blood clots, stroke, heart attacks, and cancer. And that was shorter term. That was saying, oh, you're going through menopause. We're going to put you on these hormone replacement therapies and make you feel a little bit better, get rid of your hot flashes, kind of balance out your hormones. And these women were worse off on these medications than they were not on the medications. Yet here we are saying, oh, it's totally fine to give hormonal contraceptives to women for 30 plus years. And we just give it to you and say, have a great day and hope for the best. It works. Do they work? Yeah. People don't get pregnant on them, but to what risk? These medications are not good for the body. They also change the neurodevelopment in your brain. They alter your chemicals in your brain. They actually make you less likely to want more kids. They decrease your libido. They make you think they just change the hormone function. Your hormones are meant to make you want children, right? That's the natural human race. We want children. Think about the millions of people out here right now who don't want children. Or they say, I don't want children now, but maybe when I hit 30, I'll want a child. So then I know that, maybe I hit 30 and I still don't want one, but I know I'm going to stop my birth control and just have one anyway, because I know I don't want one necessarily. I don't feel like I want one, but I know in my brain I wanted one my whole life. I'm not ready, but I just need to do it, right? And those people finally get off birth control and then finally want children. Speaking from experience, I went through this. I took birth control for several years. And I remember when I was on birth control, I was terrified. I was like, I do not want kids. I am not ready for kids. This is not a good thing. I am not having kids. And then I went through a Catholic class about contraception and conception and what it means to be married in a Catholic church. And for the first time ever, I thought, wow, maybe this is my birth control telling me I don't want kids. And I stopped my birth control. And within 3 months, I wanted kids so badly. And I think, truly, I do think that the estrogen and the progesterone that I was taking was suppressing the hormones that women have that help them desire children. The hormones have also been shown to change attraction between men and women. Women on birth control are more attracted to effeminate men. They're more groomed, they're a little bit more, feminine in their ways. They're not necessarily women, but they're just, they're a little bit more groomed and taken care of and just effeminate, right? But women off of birth control are more attracted to more rugged men, men who hunt, men who do, work with their hands and have beards and, they're just more attracted to manly men is what we would call that, right? And I think that is a huge impact that comes from using birth control. So I don't like to pretend that birth control causes no problems. Take your medicine, you won't have babies, we'll have a great day. Well, yeah, except you're going to have increased risk of all these side effects and it changes your hormones.